What follicle size should you expect when taking letrozole? When you're using letrozole to help with ovulation, the size of your follicles can tell you a lot about how your treatment is progressing. Letrozole is an aromatase inhibitor that lowers estrogen levels, which then prompts your brain to release more hormones that stimulate your ovaries to develop follicles. This process is especially helpful for women with conditions like polycystic ovary syndrome or unexplained infertility. Typically, during letrozole treatment, your doctor will monitor your ovaries with ultrasound scans. The goal is to see a dominant follicle growing steadily. Usually, by around days 10 to 12 of your cycle, a follicle might reach about 15 millimeters in diameter. However, for ovulation to occur naturally or be triggered medically, the follicle often needs to grow larger, generally between 19 and 23 millimeters. This size range is considered optimal because it is associated with higher chances of successful ovulation and pregnancy, especially in intrauterine insemination cycles. Research shows that follicles measuring between 19 and 23 millimeters tend to be the most effective for triggering ovulation, leading to better pregnancy outcomes. Some studies suggest that larger follicles, up to 28 millimeters, can also be beneficial, but excessively large follicles might carry risks, so careful monitoring is essential. Monitoring is key. Your healthcare provider will use ultrasound to track follicle growth and determine the best time to trigger ovulation. Besides follicle size, they also look at the thickness of your endometrial lining, which should ideally be more than 7 millimeters for the best chances of implantation. For women with endometriosis or other fertility challenges, letrozole can be a helpful tool to induce ovulation. But because individual responses can vary, it's important to work closely with your doctor. They can personalize your treatment plan based on how your ovaries respond, ensuring the best possible outcome. In summary, when taking letrozole, you can expect follicle sizes to range from about 15 millimeters early on, with the optimal size for triggering ovulation often between 19 and 23 millimeters. Remember, everyone's body is different, so regular monitoring and professional guidance are essential to safely and effectively support your fertility journey. Always consult your healthcare provider for personalized advice tailored to your specific situation.